This is a HSC PDHPE video, and we're looking at Core 1, Health Priorities in Australia, and we're up to Key Idea 2 and the second dot point. The dot point is high levels of preventable chronic disease. Now the syllabus requires you to have an understanding of 3 different diseases: cardiovascular disease, cancer, and one other. And for the purpose of this video, I'm going to be focusing on cardiovascular disease, and in some other videos you can learn about cancer as well as diabetes. So there's 5 different areas that the syllabus requires you to have an understanding of when it comes to cardiovascular disease, and the first of these is the nature and extent of the problem for CVD. Now the main cause of most CVDs in Australia is this term called atherosclerosis, which is a build-up of fat and other rubbish which forms as plaque inside the arteries, and that then prevents blood flow to many different areas of the body, causing many cardiovascular disease. So it includes diseases and conditions of not only the heart but also arteries and also blood vessels. Now the main type of cardiovascular diseases are coronary heart disease, stroke, atherosclerosis, and also congenital heart disease, and I'm going to have a brief look at each of those right now. So coronary heart disease is also termed ischemic heart disease, and that's quite a common multiple choice question, and it's the most common of all CVDs, and it often ends up in severe heart attack, where blood flow through the vessels to the heart is actually blocked. Lesser seriousness is angina, which is temporary loss of blood flow to the heart. Stroke is where, you've probably heard of that before, is where blood flow to the arteries to the brain is often blocked, causing localized bleeding of the brain or blockages to the brain. Now depending on where that occurs on the brain, a person's life could be impacted through either eyesight problems, hearing problems, balance, or just to name a few. We then move on to the more serious of them, which is cardiomyopathy, which is pretty much complete heart failure. And you can see there the heart either becomes thickened, stiff, and just reduces its effectiveness, causing complete heart failure. Peripheral vascular disease, as the name peripheral suggests, means on the outside, so blood supply to the legs and arms becomes impacted. In its most serious cases, it can result in amputation, but more common is this disease called DVD, known as deep vein thrombosis. Congenital heart disease, which is a birth defect, and if the doctors pick that up early enough, it can be operated on at a young age, and patients can often lead a normal life. The next of the dash point is extent of the problem. So how big is the problem of cardiovascular disease in this country? Now the good news is, in the last 2 decades, the death rates for CVD have fallen significantly, and this is attributed to improved prevention and detection in this country. So an example of that would be a patient going to their local GP for a checkup, and the doctor decides to put them on the blood pressure machine, and the doctor picks up that they're a candidate for hypertension and puts the patient on blood pressure medication, therefore reducing their risk of stroke later in life. Some of the risk factors have also changed in this country, so there's been an increase in obesity rates, but also a decline in smoking. So with obesity, that's obviously increased the rates of cardiovascular disease in this country, but the decline in smoking has led to decreases in CVD. More males die than females from CVD in this country. It's still the #1 cause of death in this country, but the gap is closing, with cancer now a very close second. Risk and protective factors is the next of the dash points. Now, risk factor is anything that increases your chance of experiencing a disease. So in the case of cardiovascular disease, poor food choices is obviously one of the #1 risk factors. The real problem happens is when there's a combination of risk factors. So an example of poor diet, physical inactivity, and someone who has high levels of alcohol consumption greater increases the chances of a person suffering cardiovascular disease. Risk factors get divided into 2 different areas: non-modifiable and modifiable. Non-modifiable is when the individual has no control over, and some examples there are age, ethnic background, and family history. Modifiable risk factors is probably what the health system in this country is more concerned about, is because these can be prevented, and what causes many of the CVD illnesses in this country. Some common examples are smoking, people who have poor diet, which leads to high cholesterol, high blood pressure, which is readings pretty much of that systolic figure of over 140, people who are physically inactive, and sorry for the picture there, but people who are suffering from obesity. Now, the flip around of that is protective factors. This is what people do well to reduce the risk of obtaining CVD later in life. And one of the number one ones here is people who are physically active. Now, the recommendations are 30 minutes of moderate intensity physical activity on most days of the week. Excuse me. Other factors there, people should have low alcohol consumption. The suggestions for males is no more than 2 drinks a day, and for women they aren't quite as lucky. They've got to limit their alcohol consumption to 1 drink a day to stay safe. Have low cholesterol levels, so that's pretty much made up there of having this. So this is a diet. Of course, eating plenty of fruit and vegetables will significantly reduce the risk of CVD. The socio-cultural, economic and environmental determinants. So these are the 3 areas that we often look at to see what increases the rates of CVD. So in terms of looking at socio-cultural determinants, I'm going to come up with 3. So different cultures and their food choices. So we'll have a look at, we'll pick on the Greeks here. They have a very strong family culture where they often get together and eat around the dinner table, and often a lot of their diet is poor food choices that's high in fat. Now the flip side of that is many Asian cultures which have a very good health food choices, such as all the rice that they eat, and they have lower CVD rates compared to the rest of the population. Now, cultural attitude towards smoking has been increased negative attitude towards smoking in this country, which is obviously a good thing. That's led to a decrease in smoking and therefore reduction in CVD. Another issue in the last 2 decades with both mum and dad both working, it's led to less chance of opportunities for parents providing nutritious meals because there's less time, then greater reliance on takeout food. Socioeconomic status, that's pretty straightforward. Eating healthy food is expensive. People on low socioeconomic status are less likely to be able to afford healthy food choices. Number one thing in terms of reducing cardiovascular disease is considered low education. It's been proven that people of low socioeconomic status just make poorer health decisions. So they suffer higher cardiovascular rates than the rest of the population. Environmental determinants. We'll pick on people here living, unfortunately, in remote areas of the country. They just have less access to healthcare facilities. So they often have to travel hundreds of miles to make doctor's appointments, which is important in prevention. Finally, groups at risk. We're going to look at 3 groups here. The ATSI group. You can see from this graph they have death rates far higher than the rest of the population. In fact, it's 1.3 times higher. That's significant. 1 in 10 ATSI people actually suffer some form of CVD in their lifetime. We're going to combine 2 groups here together, groups of low socioeconomic status and people living in remote areas. They have mortality rates 1.4 times higher than the rest of the population, and again that's simply unacceptable, and some of the factors on the previous slides there talking about the determinants of health are reasons for that. For all 3 groups, they suffer hospitalisation rates far higher than the rest of the population in terms of being admitted for CVD. So that's an overview of CVD. I hope you learnt something. It's a bit of a brief overview. To get more detailed information, you probably need to hit your textbook and get on the web. I hope you learned something. If you require further PDHPE information, you should get to www.coachpdhpe.com. Thanks for listening.